Okay, good afternoon, everyone, and welcome to Gold, the webinar series of the Philippine Society for Microbiology and Infectious Diseases. I am Dr. Mark Christopher Pasayan, and I will be moderating today's webinar. So this is the fourth of the four webinar lecture series of the Philippine Society for Microbiology and Infectious Diseases. And this is actually a prelude to the 50th anniversary and the 42nd annual convention of the PSMID. For this afternoon's webinar, this is entitled Deliverance, Living Better Normal with COVID-19. And it's my honor to be in the presence of four phenomenal women who are very distinguished, very much distinguished um, in the field of infectious diseases. And I'll tell you, they are very excited actually to start the webinar, and they're being very prepared for this since early this week. But before I introduce them, I'd like to give the house rules for this webinar. Please, um, if you have any questions or comments, you may do so by giving your comments at the typing your comments in the comment section of the YouTube channel and the Facebook page of the PSMID. Um, and we are also being streamed live in those two websites. Now, to begin this webinar, I'd like to introduce our speaker. Our speaker is Dr. Evelyn Rojas. She is a clinical associate professor at the Division of Infectious Diseases of the UPPGH. She's also an associate professor at the Department of Medical Microbiology of the College of Public Health of UP Manila, and she's the president of the Philippine Hospital Infection Control Society. After the lecture, Dr. Rojas will be joined by three panelists. Um, the first one is Dr. Jemeline Garcia. She is an infectious disease specialist practicing at the Research Institute for Tropical Medicine and at the Asian Hospital and Medical Center. She's a member of the PSMID Technical Working Group on Infection Prevention and Control Guidelines for outpatient clinic resumption and risk assessment of surgeries in the context of COVID-19. Our second panelist is Dr. Cherry Abu. She is a professor and an ID specialist practicing in De La Salle Medical and Health Sciences Institute and Our Lady of the Pilar Medical Center in Cavite. Her other passion is in medical education. And our last panelist would be Dr. Pamela Ferrer. She is a practicing ID specialist and internist in Davao City. She is a medical specialist 3 and chair of the Section of Infectious Diseases, Department of Internal Medicine in Southern Philippines Medical Center. She's a member of the Board of Council of the PSMID and president of the PSMID Southern Mindanao chapter. With that, I'll pass it on to our speaker, Dr. Evelyn Rojas.
Thank you very much, Mark, for that kind introduction. And again, we would like to thank the Philippine Society for Microbiology and Infectious Diseases for inviting us and giving us this opportunity to talk, to be one of the part of the 4-day webinar series as a prelude to our annual convention this year. So we are Team Webinar D. So D of the gold, meaning Deliverance. So living a better normal with COVID-19. So this is the last of the 4 webinar series. So towards better normal tayo, diba? We are on the 9th month of the pandemic. So how do we live with COVID-19? So I am Dr. Eva Rojas, and here are my objectives. So I will be discussing mainly the preventive measures in getting COVID-19. So sa bahay, at work, at sa community. I'll be mentioning also the DOH 5-point strategy in establishing the new normal in daily routine. So paano nga ba mabuhay sa panahon ng pandemya? So I'm sure wala sa kahit na isa sa atin ang nakaranas ng pandemya na ganito kalaki at this time. And discuss the infection prevention and control measures, particularly in the outpatient setting in the context of COVID-19. Kasi isa to dun sa marami daw na um, nangangamba sa atin na pumunta sa ospital. So, pwede na bang pumunta sa ospital sa panahon ngayon? So, to begin with, I just want to emphasize na nung February 11, 2020, so yan yung nabinyagan talaga na meron tayong novel. So, novel meaning new disease secondary to a novel or a new virus, yung severe acute respiratory syndrome coronavirus 2. So, causing coronavirus disease or COVID-19. So, sabi ko nga, meron pa bang may mas ibang sisikat sa word na COVID-19 for 2020? So I think wala, no? So COVID-19, February 11, 2020. So paano nga ba ito nakukuha? So we're on a webinar session about prevention. So I always start my lecture about prevention kung paano mo ba talaga nakukuha itong COVID-19. Kasi knowing how we really get it or how is it transmitted is will give us the opportunity to prevent it properly also. Sabi kasi nila sa infection prevention and control, dapat sakto lang. So hindi sobra, hindi kulang. So sakto lang. So paano magiging sakto? Dapat alam natin kung paano talaga ito nakukuha. So si COVID-19 ay isang respiratory disease and ang main mode of transmission nito yung tinatawag naming respiratory droplet. So ano ba yung respiratory droplet? So it is consists of water containing the virus, yung SARS-CoV-2 nga, na napoproduce whenever we exhale or we sneeze or we cough. Okay? So, ang characteristic ni respiratory droplet, isa siyang malaki. So, ang size niya is more than 5 to 10 micrometers in diameter. So, having this size, it cannot go farther than beyond 6 to 12 feet. Kasi nga malaki, so may tendency to fall on the ground. So, hindi ganun layo ang reach niya. So, sabi nila, hanggang 6 to 12 feet ang naaabot ng isang respiratory droplet. At ang SARS-CoV-2 ay natatransmit mainly via respiratory droplet. But aside from that, meron ding isang established mode of transmission si SARS-CoV-2. So, ito yung tinatawag namin na indirect mode of transmission. So, I think na-discuss na ito sa past webinars, pero just to emphasize again, paano ba ito nangyayari? So whenever we have the infected, for example, COVID-19 patient na nag-cough or nag-sneeze without observing proper cough etiquette, so may tendency itong respiratory droplet na mag-fall sa mga surfaces. And kapag itong surfaces na to ay hindi nalinisan at nahawakan ng ating kamay and on our part, hindi tayo nag-perform ng hand hygiene and we touch, ayan, yung sinasabi, eyes, nose, mouth. So yan yung mga portals of entry kasi ni virus to our body. Then we can also get the SARS-CoV-2. So ito yung established mode of transmission talaga ni SARS-CoV-2. However, sinasabi nila na pwede rin ang airborne transmission ni SARS-CoV-2, ni virus. Whenever we perform yung mga tinatawag naming AGP or yung aerosol generating procedures, which are mainly procedures inside the healthcare facility. Kasi ito yung pag nag-intubate ka, pag nag-resuscitate. So whenever you perform these procedures, yung respiratory droplet, pwede mong ma-aerosolize. So pwedeng lumiit yung respiratory droplet and by that time, pwede siyang maging airborne transmission. Or whenever you are in a small, closed, and confined spaces with little or no ventilation, then possibility din daw or pwede ring matransmit si virus via airborne. So, knowing all of this, kasi dapat alam natin paano siya natatransmit so that we can prevent the transmission properly also. So, ang i-discuss ko ngayon is mainly yung 5-point strategy na drinaf actually ng Department of Health in establishing the new normal in daily routines. So ang goal kasi ni Department of Health is to reduce COVID-19 related and also non-COVID-19 deaths. So hindi porket nasa pandemya tayo, hindi natin dapat kalimutan yung other diseases or yung mga ibang sakit. So itong 5-point strategies na to, so they made this infographic, so mainly consists of preventing cases and managing contacts and cases early and without financial hardship. So we will be discussing that one by one. So, una daw, increase resilience. So, may finger heart pa sila, no? So, resilience meaning, despite of this pandemic, we remain resilient. So, matatag pa rin or life must go on, di ba? Diretso pa rin ang buhay. So we have to be resilient during this time. So both physically and mental. So hindi lang pang physical, but all the more mental health din. So physical meaning we have to, yung mga basic necessities, food, water, shelter, and sanitation, dapat na andyan parati yan. Physical activity, so kahit pandemic, pwedeng mag-physical activity, di ba? Ina-allow na nila as long as we can ensure na merong physical distancing. So promote basic respiratory hygiene and cough etiquette. So actually, hindi naman to bagong recommendation matagal na to. But ngayong panahon ng pandemya, so mas na-emphasize. So actually, mas okay to sa amin kasi kung hindi to napapansin before, so almost all of us ngayong pandemic, we try to comply with this. And discourage smoking and drinking of alcohol beverages then can increase your resilience. And as I've said, we have to protect the mental health and general welfare of individuals, particularly during this time, so COVID-19, di ba? Kaya marami ring nag-help sa atin So merong mga hotlines wherein we can call actual Department of Health to provide the mental health support that we need. So next, stop transmission. Okay, so paano ba mape-prevent yung transmission ni virus? So ayan, hand hygiene. So kung meron mang magandang naidulot si pandemic, so sabi namin na during this time, mas naging aware ng mga tao mag-perform ng hand hygiene. So bago si COVID-19, sino ba ang pumapansin sa hand hygiene? So hindi gaano hindi marami. So konting-konti lang siguro. But ngayon, so as we can see, almost all of the people are aware. So kahit aware lang of proper hand hygiene and also practicing hand hygiene to prevent the transmission of the virus. So also, symptomatic individuals to stay at home unless there is a pressing need to go to a health facility. So, diba sabi nga ni Kim Chu, bawal lumabas. Actually, tama yun So, kung hindi naman necessary na lumabas, okay, so kailangan stay at home lang yan, lalo na for mga at-risk population, pero dapat nakabalance din naman to. So, hindi naman dekahon. So, kung kinakailangan pumunta ng ospital, it's necessary, pwede rin naman. So, kailangan proper knowledge and information how to balance this. Also, para ma-prevent ang transmission, clean and disinfect the environment regularly. So mamaya I will be discussing this. So you can see how big the impact of this in preventing the transmission of this novel virus. And rational use of PPE that is suitable to the setting. Ito yung sinasabi namin. IPC dapat sakto lang. Hindi sobra, hindi kulang. Yun yung sinatawag namin na rational use of personal protective equipment. Kasi minsan pag naka-PPE sobra, baka it will do harm than doing good to you. So mamaya di-discuss natin yan. So next, pang third dun sa 5-point strategy ng DOH, reduce contact rate. So may base or may basis yung physical distancing na recommendation ni WHO, ni CDC, or even dito sa ating bansa ng mga medical societies. Physical distancing at all times can reduce the transmission of the virus by reducing the contact rate. So base po ito sa siyensya, so merong basihan or merong basis. Yung sinabi kong mode of transmission, di ba nga, since droplet siya, hindi ganun kalayo ang nare-reach, malapit lang. So when you observe distancing, then you have lesser risk or lesser probability of getting the virus. So as well as restricting unnecessary mass gatherings. So of course, when you mingle or lesser people na i-interact sa'yo, the lesser chance then na you'll get the virus. So same with limit non-essential travel and activities and engineering controls. So ang lahat ng ito nire-recommend to achieve this strategy of reducing the contact rate. So yung mga engineering controls, andyan yung mga barriers, yung mga face shields, mamaya di-discuss ko rin. So next, shorten the duration of infectiousness. So kung meron nang nahawa, so hindi naman 100% mape-prevent, diba? So meron talagang nagkakaroon ng cases. So pwede pa bang, meron bang pwedeng gawin doon para ma-prevent ang transmission? So yes. So shorten the duration of the infectiousness by identifying the symptomatic individuals right away. So this has very important role in preventing the transmission or further spread of the virus. So kung alam mo na medyo symptomatic ka, then you have to undergo evaluation para ma-check kung COVID ba ito o hindi. And then refer the symptomatic individuals sa proper health system. So hindi pwedeng sabi lang ni kapitbahay or self-medicate kasi iba-ibang tao, iba-ibang condition. So it should be properly assessed by a doctor. And then, ito, very important din. So, trace and quarantine close contacts of confirmed individuals. So, studies show that a very good contact tracing is a key in the prevention of the further spread of the virus or the transmission of the virus. Ngayon, so gaano ba tayo at risk for contracting COVID-19? So, iba-ibang tao, iba-ibang sitwasyon, iba-iba din ang risk sa possibility for getting the virus or getting COVID-19. So, it depends on individual, activity, and locality. So, for individual, ito alam na natin lahat, pero I just want to emphasize that elderly, so more than 65 years old, and those with underlying medical conditions compared to less than 65 years old population and those without medical condition, they are at higher risk for getting the virus and higher risk of developing a more severe or more complicated course. So yan, meron din yung basihan. So ito yung tinatawag nilang risk of individuals and whether you are living alone or when you are living with other individuals. So, sa bahay, kung marami kayong magkakasama, then meron sinasabi you're more at risk for getting the virus. Also, the risk of activity. So, yun nga, ulit-ulit, pero number of people participating in the activity. Kaya bawal ang mass gathering as much as possible, di ba? Pero ngayon, nakita natin unti-unti, dumadami na yung mass gathering. Pero as much as possible, kung malilimit natin yung gathering, kasi mas kuonti yung number of people, then that's lesser risk for getting the virus. Also, the ability to maintain the physical distance, the duration of the activity, I think narinig ko to sa previous webinar ni Dr. John T. na the longer that you stay in that activity, syempre, more chances, di ba, of getting the virus kasi mas matagal mong kasama yung possible na merong SARS-CoV-2. So it depends also on the actions and interactions the activity entails. So the closer the activity, syempre the higher risk of getting the virus and the venue and the environment. So when you're doing the activity in an enclosed environment, then the higher the risk or the chances of getting the virus too. So lastly, risk of locality. So depende sa lugar mo. So ang risk natin might be different from the risk sa US or sa other Asian countries. So it depends on the epidemiologic situation, so case doubling time and health systems capacity. So yung case doubling time and the critical care utilization are said to be the considerations for the community risk classification or yung quarantine measure. So, diba, since March, sanay na tayo sa mga CQ, so ECQ. So presently, NCR, dito kami sa NCR, still we are on GCQ until November 30. So because of this case doubling time and critical care utilization. Okay, so knowing all of this, diba, until now, so to date, wala pang established na approved na drug. Okay, so pharmaceutical intervention against SARS-CoV-2. So with this, we capitalize on the non-pharmaceutical interventions or your NPI. So habang wala pang gamot at wala pang bakuna, so we have to observe all of this to prevent the transmission of the virus. So unang-una, cough etiquette. So again, cough etiquette is described or defined as covering your nose lang. So simple etiquette diba? So kapag bumahing ka or umubo, so we try to cover our mouth. So, pwedeng may tissue, pero si tissue dapat itatapon mo sa basurahan and you perform hand hygiene after contact with your respiratory secretions. Okay? Or pwede rin naman daw yung gamitin yung braso sa pagtakip sa mouth mo. And then you avoid touching your eyes, nose, and mouth nga because these are the portals of entry of your virus. So next, hand hygiene. So always perform hand washing and hand hygiene. So maraming matutuwa sa amin nga nito kasi marami na nagpa-perform, hindi man hand washing, pero yung with the use of alcohol-based hand rub. So pwede naman yan, sabi ni DOH, saka ng WHO, with 70% alcohol. So whenever you have the opportunity to perform it, so dapat gawin din yan. And then, yan. So ipapakita ko lang to. So yung si virus daw, viable, so pwedeng manatili on these different surfaces. So pwedeng mabuhay on these surfaces depending on the characteristic of the surface. So iba-iba kung paper, kung steel. Pero anong message dito? So yes, they can be viable on these different surfaces, but as long as we clean it and disinfect it, so pwede namang mawala or mamatay si virus. So sabi nga nila, binabalance ni God lahat, di ba? So although we have a novel disease now, but SARS-CoV-2 is considered as a virus na pwedeng mamatay or mapatay, ma-disinfect with low-level disinfection. So unlike yung TB or yung spores wherein you really have to sterilize to kill the organism, si SARS-CoV-2 with low-level disinfection lang. So manual disinfection, punas, and then cleaning and disinfecting, pwede siyang mamatay. So, ayan. Environmental hygiene is another important non-pharmaceutical, pharmacologic intervention to prevent transmission of SARS-CoV-2. So, start with cleaning, so with soap and water, and then with the use of disinfectants, so chemicals for disinfecting. So, si disinfecting, siya yung pumapatay talaga sa virus. And nagsabi na si DOH kung ano ang recommended na disinfectant. So it's either 70% ethyl alcohol, so ito talaga yung nire-recommend nila, and a 1:10 to 1:100 sodium hypochlorite. So si sodium hypochlorite, ito yung usual na household bleach. Hindi ako magbabanggit ng brand kasi bawal, no? So household bleach na meron tayo. So murang-mura, di ba? Household bleach. Alam ko, mga 65 pesos per ano to eh. Kasi parati akong bumibili sa grocery. So with that murang price, with proper use, pwede mong malinis yung environment and you can help in preventing the transmission of the virus. And sino ba yung nililinis? So they say, disinfect yung commonly touched surfaces, yung mga doorknob, yung mga keyboard sa computer nyo. And also, so more commonly sila, mas madalas, more frequent. Pero yung other surfaces din, pwede rin namang linisin. Okay? Or i-disinfect properly. Okay. So speaking of disinfection, so ito lang gusto kong sabihin to the public na yun nga, sodium hypochlorite yung ginagamit natin na disinfectant. Pero alam nyo ba, sa hospital kasi or maybe in your work, pwede kasi yung i-reconstitute. So dapat whenever you use or you prepare the solution for 1 day lang kasi may expiration date yan eh. So na-expire siya. So wag kayong magtitimpla ng 1 galon for 1 month's time. So dapat daily kasi nga na-expire siya. And we have to always remember na chemical to, so we have to protect ourselves. Careful lang din sa pag-prepare ng disinfectant. Okay, so another intervention. So use of face mask and face shield. So ngayon, meron pa bang Pinoy na hindi naka-face mask? So I think compliant naman ang Pinoy with this intervention. So face mask and face shield. Actually, face shield nga, di ba? Nirecommend na nila. Pero bakit marami pa rin tayong cases? So sabi kasi nila, oo, nag-mask tayo, pero hindi proper. Hindi tama yung paggamit ng mask. So I just want to emphasize here na it's not just wearing mask. It should be proper use of mask. So lahat ng to, ayan, marami tayong nakita niyan, yung mask na sa baba. Your mask should cover your nose and your mouth. So that's the goal of the mask. So pareho yung ilong tsaka yung mouth, dapat nako-cover ni mask. And ayan, huwag nyo i-headband si mask. So this is the proper use or proper way of wearing the mask daw. So pag N95 kami sa hospital, healthcare worker yan, and pag usual face mask, it should cover your nose and your mouth. So according to yung guideline, so yung mask din, depende sa setting. Okay? So pag nasa community lang, pwede naman yung cloth mask. So hindi necessary na yung mga surgical mask, and all the more na hindi po necessary ang N95 sa community. So we just want to emphasize that. So cloth mask if in the community, however, kapag, ayan, sabi nila, pag may respiratory symptoms or for healthcare workers taking care of patients with respiratory symptoms, we have to wear face mask. And then, kapag COVID confirmed, kami yung mga nasa hospital, we increase, so parang in-elevate namin into an N95. Pero if other than that, kung nasa community lang, you can just use cloth mask. So, that's the rational use of face mask. So, universal masking daw, di ba? Wear face mask all the time. Pero pwede namang tanggalin to during this condition. So, except, of course, eating and drinking, di ba? Paano ka kakain when you have mask? So, but still, you have to observe this. So, at least 2-meter distancing. Di ba, sinasabi nila minsan, bakit sa hospital we have cases pa rin? Kasi nakakalimutan during this time na mag-observe nung minimum public health measures pa rin. So, kahit na kumakain, wala kang mask nun eh. All the more that you have to observe physical distancing and at designated dining area. Pwede rin hindi mag-mask when you perform high-intensity physical activities. Diba sabi nila, pwede nang mag-exercise ngayon. So that's part of the physical resilience. Oo. So kung nag-jogging or other high-intensity physical activities, you can remove the mask as long as you're the ones performing it. And yun nga, maintain pa rin ang 2 meters physical distancing. So they don't recommend wearing mask din sa children kay less than 2 years old because may tendency for suffocation. So, hindi mo makokontrol. And di ba bata, bawal lumabas. So, as long as nasa house naman, it's not necessary to wear mask. And for those who are unconscious, incapacitated, or unable to remove the mask. So, during these times, pwede mong walang mask ang isang tao. Then we have physical distancing. So I just want to show here the ito for respiratory droplet daw. So kapag nag-sneeze, so medyo forceful kasi pag bumahing, di ba? Sneezing, the droplets daw, the farthest that it can reach is around 6 meters. When you cough, it's around 3 meters. But with the usual exhaling, huminga ka lang, it's 1 meter. Kaya nire-recommend nila minimum na physical distancing is 1 meter. And yun nga, sinabi ko, the rationale behind this. And actually, science support this. So may mga scientific papers na showing na when we perform or when we observe physical distancing, so it can decrease the chance of getting the virus or the transmission of the virus. Okay, so lastly, I just want to share here the guidelines that we made, PCP, Philippine College of Physicians, Philippine Society for Microbiology and Infectious Diseases, and Philippine Hospital Infection Control Society with regards to the infection prevention and control guidelines for the outpatient clinic resumption in the context of COVID-19. So sabi nga nila, safe na ba? Pwede na bang bumalik sa ospital? Diba? Kasi nung March talaga, April, ECQ tayo, so naapektuhan itong mga outpatient clinic. So during this time, so I think simula nung nag-GCQ tayo, nag-start to open up na rin ang mga ospital. So pwedeng pumunta na sa ospital ngayon, sa panahon na to, but as much as possible, so during this time, nag-surface din yung telemedicine. So medyo mas umangat si telemedicine kasi nga, sabi nila, face-to-face physician-patient encounter as much as possible or as much as feasible should still be minimized. So kung po pwedeng telemedicine, okay, kung po pwede naman na yon, hindi ganun ka-emergency, then we go for telemedicine now rather than face-to-face. But since bago ito, dapat hindi natin kakalimutan that informed consent should be obtained from our patients whenever we do telemedicine. So next, so yes, we can go back to the hospital now. So pwede na as we slowly opening up. Okay, so going back to better normal nga, di ba? as long as we follow this hierarchy of control. So actually, ito yung generic na hierarchy of control, but they made it more specific in terms of COVID-19. So on top of the hierarchy actually is the elimination. But it's very difficult really to achieve elimination if we're dealing, di ba, with unseen enemy nga si virus. So we capitalize on these other controls like the engineering and administrative controls and the use of PPE. So actually, si PPE is at the bottom of the hierarchy, pero yun ang most common din na gagamit natin. So sa outpatient clinic, ang nire-recommend both for doctors and the patients then is this, ayan, di ba, may cameo roles, si Dr. Roman ang model natin. So, ang minimum PPE na nire-recommend is wearing of mask or kung meron kang aerosol generating procedure na gagawin sa clinic mo, kung ikaw ay doktor, pwede naman ang N95 and yung face shield. So actually, ito rin yung nire-recommend sa community. So your mask to cover your nose and your mouth, and then your face shield or your goggles is for eye protection. So pine-prevent mo yung tatlong possible portals of entry ng virus. So we emphasize the rational use of PPE kasi nga, sabi ko nga, hindi porket sobra, mas tama, di ba? So dapat yung sakto lang. And sa outpatient clinic, ito yung nire-recommend nila. And then sa hospital, we observe this So meron ng physical distancing sa elevator, sa waiting area, we have this chair arrangement. And naging aware na rin tayo dun sa importance ng ventilation, di ba? Sabi nila, if you can open your windows, okay, sa clinic mo, it's better. That's natural ventilation. Okay, so the more air exchanges, ang nire-recommend nila 6 to 12 air exchanges per hour. Okay, so mas maraming nag-circulate na hangin, the better. Or kung hindi naman kaya ang opening ng windows, pwede ring mechanical ventilation with the use of exhaust fan. Okay, so speaking of exhaust fan, so pwede kong mag-install sa clinic nyo or sa room nyo. So, pero ang air dapat should be directed away. Wag naman yung exhaust fan towards the waiting area. Okay, so kawawa naman yung mga tao mga pasyente sa waiting area. Of course, towards the outdoor, away from populated areas. However, kung hindi nyo ma-open yung window sa clinic nyo or sa room nyo, and then hindi rin pwede mag-install ng exhaust fan, then you can use HEPA filter. So I'm sure all of us are aware of HEPA filters ngayong panahon ng pandemic, di ba? Tumaas ang sales ni HEPA filter. Pero ano ba si HEPA filter? So HEPA, so meaning high efficiency particulate air filters. So ang ginagawa niya is it filters the particles. So 99.95% of air particles, so with diameter of more than 0.3 micrometer. So pasok si respiratory droplet. So nafi-filter niya si respiratory droplet. So they filter air and improve the circulating air, but it doesn't add to the ventilation. So hindi siya nag-i-increase ng air exchanges. Pero kung no choice kayo, then you can still use HEPA filter din para mas malinis naman yung hangin na nagsisirculate sa air nyo. So yan ang recommendation namin. So they add benefit in improving the air quality. And we should always remember, so di ba, bili ng HEPA filter, pero dapat fina-follow natin yung protocol ng manufacturers, and dapat alam din natin yung maintenance and replacement of HEPA filters within the unit. So ano pa ba nakikita natin sa clinic? Actually, hindi lang sa ospital, kahit sa mga malls, di ba? And sa building. Sino bang building ngayon na walang foot or shoe bath? So ano ba talaga ang sinasabi about foot baths? So we tried to look for scientific evidence that will directly say that it can prevent the transmission of SARS-CoV-2. Pero until this time, no, kasi may mga ongoing studies there's insufficient evidence. So sa ngayon, wala kaming evidence to recommend it, but whenever you use it, we just want to remind you na dapat you follow the manufacturer's instructions and frequency of replacement to ensure the effectiveness of disinfection. So it's not just, yun nga, for the sake of just having foot bath. So dapat, kung madumi na or kung minsan nakikita natin tuyong-tuyo na yung foot bath, no? So you have to replace it also. Ano pa man nakikita natin sa ospital? So maraming mga acrylic barriers. So ano ba? Okay ba si acrylic barrier? So acrylic barrier is part of the engineering control. So whenever you use it, pwede naman. But again, we still remind everyone or emphasize that it's still the proper PPE. So mask or face shield. And these are additional control measures lang. So additional engineering control. And ang mahalaga dito, whenever you use this dapat properly cleaning and disinfection pa rin. So I've discussed a while ago how big the impact of proper cleaning and disinfection of our environment ang nabibigay niya in preventing the transmission of the virus. So speaking of disinfection, ayan, lumalabas din yung issue ni UV. So aside from HEPA filters, so top sale siguro ngayong 2020 si UVGI, ultraviolet germicidal irradiation. So pwede ba si UV? So actually, UVs are considered as an adjunct or katulong sa pag-disinfect kasi ang main mode of disinfection talaga is via manual disinfection. So manual meaning proper cleaning and disinfection or pinupunasan yung mga surfaces. But whenever you use this UV, pwede naman. So, pwedeng yung mga UV cabinets, sterilizers, yan, UV purifiers. So, that can be an adjunct, okay, or addition to the manual disinfection. But we have to remember na whenever you use this UV light, we should be aware of the precautions kasi merong mga safety precautions si UV. So it can cause skin irritation and keratoconjunctivitis when we don't follow the manufacturer's recommendation. Sometimes it can produce ozone that is not safe for particularly those with asthma or other respiratory diseases. Okay, so ayan ang nire-recommend namin. So UV product as an adjunct, but we have to follow the manufacturer's protocols and safety precautions. So I think these are some of my few last slides na. So minimum public health measures ang dapat nating tatandaan. So physical distancing, wear mask all the time. Marami ng variation si mask eh. So meron nga daw transparent na mask ngayon para kita pa rin ang lipstick, di ba? And we cannot overemphasize hand washing. Okay, so I want to end my presentation with this very nice slide from our dear President, kay Ma'am Isa. So, CTTO ako, no? Ma'am Isa to galing. So, sabi nila, so the Swiss cheese respiratory virus pandemic defense. So, as you can see here, we have our personal responsibilities and shared responsibilities in preventing the transmission of the virus. So, ayan, sabi nila, each intervention, so each layer ni cheese has imperfections. Diba? Kaya nga may nakakalusot. So, kung physical distancing lang ang pinapapractice mo, so pwedeng makalusot si virus. Kung mask din lang, so pwede pa rin makalusot. But as you increase your preventive measures, so kung sama-sama, so may mask ka na, you perform hand hygiene, you avoid touching your face, you avoid congregation or limit crowded places, limit going to crowded places, okay? And then with the shared responsibilities, ito more of the government responsibilities na with contact tracing, improvement of the environment, ventilation, government messaging and financial support, and quarantine isolation. O tingnan nyo, nasa huli si vaccine actually. So, contrary to, akala natin si vaccine na ang ating one and only savior. So, it's part, pero actually nasa dulo siya. Kasi nga, mina-manufacture pa lang ginagawa. Then, you can prevent the transmission of the virus. Hindi siya makakarating sa another susceptible host. So, I think this is my last slide. So, thank you very much, Mark.
Thank you, Dr. Eva. Thank you for that wonderful lecture, those practical tips on infection prevention and control. Truly, sabi nga Dr. Roman, proud na proud ng Fix Incorporated dahil sa lecture mo. Let me just invite na yung ating tatlong panelists, no? Dr. Pam Ferrer, Dr. Cherry Abu, and Dr. Jem Garcia. Magandang hapon ulit sa inyo, doctors. Okay, so let's go proceed to our Q&A. No, medyo jam-pack ang ating Q&A ngayon. At ito yung ating kinaka-excitedan since this morning. So, let me start with this question, no, Dr. Eva.
Yes.
Kumusta naman ang ating construction dyan sa tabi mo? So, shout out sa ating mga magigiting na karpintero dyan. So, Dr. Eva, sa panahon kasi ngayon, no, COVID-19, 9 months na tayo may pandemya, hindi natin alam hanggang kailan ito. What should people observe? Ano kailangan observe ng mga tao now that people are going out? People are in public places. What should they observe when they are in the malls, when they are in the church, or even sa mga marketplaces? Ano ang kailangan nilang i-observe?
Kasi itong infection control na to, so yun nga, infection control procedures or these minimum public health measures, cut across yan. So whether you're in the community or nasa church or sa malls, di ba? So, pare-pareho naman yun eh. So, ang difference lang ngayon, medyo mas marami na tayong alam. So, nung early parts of the pandemic, medyo nangangapa tayo. So, ngayon, medyo alam na natin how we can prevent the transmission. Pero ang ano lang dito, ang downside or ang worry natin, minsan po alam na natin yun nga, na babaliwala, or unlike before na may sobrang guarded tayo, pero ngayon habang tumatagal, parang hindi na tayo ganun ka stiff or strict in following all those basic public health measures. So, ang ano lang dyan, ang key lang dyan is dapat hindi natin kinakalimutan na i-perform to wherever we go. Okay? So, kahit na sinasabi nila na GCQ na or malapit na tayong mag-MGCQ, we still have to perform these basic measures. Pare-pares lang sila eh. Actually, paulit-ulit lang sila, Mark. Pero we have to paulit-ulit na gawin din with all of these conditions. So, whether sa mall, sa church, or pwede na sila magsimba ngayon, di ba? Or sa mga gym. So, hand hygiene, use of mask, observance of physical distancing. So pare-parehas din lang sila. So we have just to consistently perform all of this whenever we go outside.
So duting ko na rin yung answer, yung comment mo yan. How about yung mga nakikita natin na naka-gloves habang nag-grocery? Or naka-cover all habang nasa labas ng nasa public places? Any thoughts on that, Dr. Eva?
Oo. So, di ba kanina parang twice ko sinabi na, or siguro i-quote ko nga na, hindi porket sobra, tama siya, di ba? So, minsan nga pag sobra, hindi siya nagiging right way of protecting yourself. So, dapat sakto lang. So, depende sa kung anong sitwasyon ka nakalagay. So, pag nasa community ka lang, nag-grocery, ang minimum PPE lang is actually to cover your yung tatlong portals of entry, your nose, your mouth, which is done by your mask, and then to cover your eyes, face shield or goggles. So actually si gloves, it's not necessary in the community, but whenever kung gusto, sige, gagamit sila, but it should not give you a false assurance na you'll be protected and you will not perform hand hygiene anymore. So, actually, mas hindi siya practical. So, ang recommendation, wag na mag-gloves sa community, hand hygiene na lang. Diba? Or, yun, hand washing kung merong facility. And all the more PPE ha, bawal mag-hazmat sa Robinson. Hazmat sa mall.
Okay. And yes, Dr. Garcia, you have some
Yeah,
thoughts.
gusto ko lang dagdagan yung sinabi ni Doc Eva, no? Because pag nagsusuot tayo ng gloves, baka it provides us a false sense of security. So, mas magiging complacent tayo, hindi tayo mas maingat sa pag-hand hygiene na mas marami tayong hinahawakan na surfaces, tapos nahawakan natin yung ating muka na hindi tayo naghuhugas or nag-alcohol ng kamay. So, that's why it's not recommended.
Okay. Thank you, Dr. Garcia. I'd like to ask Dr. Pam, no? Kanina natakal na ni Dr. Eva Rojas ang mask. How about can we again emphasize the use of cloth mask? How effective is this? Is it even recommended to protect us from COVID-19? And may maraming naglalabasan din na iba't ibang klaseng mask, no? Silicone mask, copper mask. What are your thoughts on these different kinds of masks?
Okay, thank you, Mark. Can you hear me?
Yes, loud and clear.
Okay. So CDC and WHO still recommends wearing of cloth mask for the general population, no? It still provides some form of protection kasi nga nagmamask tayo as a healthy individual to protect ourselves from the respiratory droplets, at kung ikaw naman ang may sakit, pinoprotektahan mo ang komunidad kasi hindi ka nababawasan ang pagiging infectious mo pag ikaw ay nagmamask. Ngayon, mas maganda pa rin or mas superior pa rin yung tinatawag natin na mga medical mask, no? Yung surgical mask, yung N95 respirators. Pero kasi dahil may shortage at mas mahal yon, mas nire-reserve natin siya sa ating mga healthcare workers, yung mga nagtatrabaho sa hospital na parating exposed sa taong may sakit. So for the general population, pwede ang cloth mask. Pero kung tayo ay nasa hospital at tayo nagtatrabaho sa hospital, yung surgical mask or N95 respirators. Now, maraming naglalabasan na different mask. Merong silicone mask, copper mask. Actually, hindi ko pa yung nagagamit kasi more of sa medical mask ang ginagamit ko. Sa copper mask, ang nakita natin dyan ay yung mga pagsusuri na nakita natin dyan ay konti pa yung datos na nagpo-prove na merong protection na binibigay ang copper, in particular, yung copper oxide na nilalagay sa mask sa SARS-CoV-2. So, kokonti pa lang. So, mas maganda kung sa mga susunod na mga weeks or months, kung may mga gagawing studies, baka makikita natin kung totoong may protection na ibibigay ang copper mask. So, ang masasabi ko lang din, it's better to wear any form of mask, pero dapat tama ang paglagay mo. Dapat natakpan ang ilong, ang bibig, well-fitted siya. So either it's a cloth mask or medical mask. Pero better ang medical mask and N95 para sa mga taong nagtatrabaho sa hospital at sa mga may sakit. Back to you, Mark.
Okay, thank you, Dr. Pam. How about yung paglilinis ng mga mask? There's a question no, sa ating public chat. How do we disinfect this cloth mask? Meron pang wood or leather or any material wherein yung bleach nga or alcohol will destroy the material. Do you have any recommendations on how to clean these PPEs?
Yung cloth mask, sa mga nakita ko, ang recommendation sa CDC, WHO, pwede mo siyang i-wash with hot water and soap. Pero doon sa copper mask, iba-iba yung mga nakikita natin sa mga studies even sa World Wide Web, iba-iba, merong sabing la alcohol. So baka kailangan pa ng mga future studies para makita natin kung anong pinakamagandang way to disinfect them. Jem?
Yeah, and to add to that, you have to check always yung manufacturer's instruction. Pag may bibilhin kayong mask or anything, actually, meron silang instruction kung paano nyo sila lilinisin. No, so yun tayo magdedepend kung ano yung instruction. May nakita lang din kasi akong question mark on how to disinfect the silicone masks. Yes. No, I guess they're referring to the elastomeric mask, yung mga ginagamit ng mga healthcare workers sa hospital. So I assume doctor ang nagtanong nito, no, kasi hindi naman po recommended sa public na gumamit ng elastomeric mask. So paano yung tamang pag-disinfect? Again, you check the manufacturer's instruction, but generally, this is what we recommend, no? So yung elastomeric mask, meron kasi siyang filter, no, or cartridge. So tatanggalin nyo muna po yon bago nyo linisin. So ihiwalay mo yung cartridge or filter, whatever is attached to your mask. Tapos matitira sa'yo yung silicone face piece, no? Yung face piece na yon, lilinisin mo siya with 1:100 dilution ng chlorine. Yung chlorine solution na pinakita ni Doc Eva kanina, iwa-wipe mo yung surface nung mask. Ang recommendation is to use a cloth na binasa mo nung chlorine solution. Hindi po recommended na mag-spray doon sa mask kasi baka mas lalo mong ma-spread, no, yung mga contaminants. So, gagamit ka ng cloth, babasain mo yun ng 1:100 chlorine solution, and then you wipe the surface of your face piece. Allow for 10 minutes na contact time. And then after 10 minutes, you wipe it with sterile water and then allow it to air dry. And then pag tuyo na siya, pwede mo na siyang itago sa brown bag, sa paper bag, or Ziploc. Now, for the filter, kung filter yung naka-attach dun sa mask ninyo, ang gagamitin yung panglinis sa outside surface ng filter is alcohol. And then you also allow it to air dry. And then pag tuyo na siya, ilalagay mo rin siya in a separate paper bag. Or kung yung pink naman sorry, so that's for the cartridge. I'm sorry. For the filter naman, yung kulay pink, ito kasi yung porous. So, hindi mo siya pwedeng punasan. So, ang gagawin mo doon, ipaghaharap mo sila face-to-face, tapos ilalagay mo rin sila in a separate paper bag. And then, pwede mo sila...
Pancake, no?
Yes, yung parang
pancake
na pancake. Hindi yun dinidisinfect. Porous kasi yung material. So you just put them face to face, tapos ilalagay mo sila sa paper bag, and then you put them in a separate cabinet. And they are ready for use. Ang important lang, bago mo sila ibag, yung mga pinunasan mo ng alcohol and chlorine, make sure they are already dry. And after you clean your mask, make sure you perform hand hygiene. That's it.
Ang mabusisi pala talaga ang elastomeric mask.
Natutunan ko po yan sa infection control nurse namin, si Pao. Hi, Pao, if you're watching.
Since we're talking about elastomeric mask, my infection control nurse, Ms. Camille Garcia, has this question. Meron siya mga observations na kino-cover yung elastomeric mask ng bouffant cap, sometimes face mask, sometimes yung cover na nga, ginagamit nilang pang-cover. Dahil daw, this is to prevent transmission ng infection from the end user to the other people within the distance. What's your thoughts on those kinds of maneuvers na ginagawa ng mga elastomeric mask users?
Sige.
Doc Jem?
For me, I think there's no evidence that it will actually prevent transmission, because if you look at yung mga bouffant caps or even the shoe cover, hindi naman siya mag-filter, no, ng droplets ng mas I think mas nagpe-penetrate, mas nag-allow din naman sila. So I don't have any evidence to say na it will prevent the transmission from the user to another person.
Mm-hmm.
Well, we'll still go back to the minimum public health standards. No? Even if you're in the hospital naman, kung nakikipag-usap ka sa iyong nurse or sa iyong colleague, you still maintain the distance even if you're wearing your PPE. Of course, we're always erring on the side of caution.
Right.
No? We still try to observe the minimum public health standards.
And nakakatakot, no, the risk of suffocation also kasi multiple layers of barriers sa breathing when you're going to do that. Okay, thank you for that, ladies. I'd like to address this question to Dr. Cherry Abu. Hi, ma'am. About public transportation. Again, in the we are in that better normal na, adapting to COVID-19. What should people observe when using the public transportation? MRT, bus, jeepney, or even tricycle, pedicab, no? There's another comment din kasi that in public transportation, for example, provincial buses which will require long hours of travel, are minimum health protocols enough since buses do not have HEPA filters similar to the aircrafts or airplanes? What are your thoughts, ma'am?
Yeah. Kahapon tinanong yan no? Kasi nandun tayo sa topic ng travel. So, as we continue to reopen no, for business, para sa ekonomiya, eventually, mag-open na rin siguro yung mga schools. Syempre, there's going to be a lot of people who need to commute. Diba? So, kailangan talagang i-expand yung public transport. May mga nilabas na mga guidelines ng DOH. Yung una is the use of, ito lang sa mga short distances ha. Syempre kung malapit lang naman yung bahay mo sa pupuntahan, wherever you're going, workplace man yan, or sa palengke or sa grocery, kung kayang mag-bicycle at saka maglakad, better yon for two reasons. Number one, pwede kang mag-physical distancing kapag ganun yung mode of transport mo, no? Pangalawa, it will also give you an opportunity para sa exercise kasi 'di ba gusto nila mag-exercise then during the period of pandemic mga 30 minutes. So okay 'yon. Yun lang.
syempre may mga provisions nga ang government na sana maglagay ng mga bicycle lanes at saka kung saan maglalakad yung mga tao. Kasi para safe naman, di ba? Ngayon syempre kung hindi naman siya walkable, yung pupuntahan mo, kailangan ka nang gumamit ng jeepneys, ng bus o MRT, LRT. So may mga kailangan tayong tandaan, no? So meron akong kababasa ko lang dito, the seven commandments of public transport. Actually, yung first commandment doon is because of yung pagpayag ng ating Department of Transportation na pwede na yung one seat apart. 'Di ba? So may mga makikita tayo sa mga jeep, sa mga bus na may mga X o kaya may mga barriers para hindi upuan. As you can see, this is less than the required 1 meter, no, for adequate physical distancing. So paano gagawin natin? We have to add more precautions. Ito yung sinasabi rin kahapon na dapat bundles kasi hindi naman talaga pwedeng isang preventive measure lang. So number one, if you're going to go public transport, you have to wear mask and face shields. No, ginagawa naman na natin yon. Number two, wag tayong magdaldalan. No talking, and if possible, wag na tayong sumagot or gumawa ng phone calls. Kasi minsan hindi mo naririnig, sisigaw ka na o kaya ibababa mo ng konti yung mask mo para magkarinigan kayo. Number three, medyo mahirap to dun sa mga long na biyahe, pero kung short, no eating. Kasi it's during yung meal time or kung kakain o iinom na tatanggalin natin yung mga mask natin. We have to keep the public utility vehicles adequately and appropriately ventilated. Mas maganda talaga yung open windows for free flow of air. Tapos yung frequent disinfection. So sana nakikinig po ang ating mga public transport managers or owners. Kailangan i-disinfect po yung mga ating vehicles, no? Yung number 6, medyo mahirap gawin kasi parang walang mag-check. Sabi nila, no passengers with COVID-19 symptoms should be allowed to get into the vehicle. Siguro at the most mag-check lang ng temperature, no? 37.8, yun yung sinasabi na hindi papasakayan. Pero I wonder how we can do that sa ibang transportation modes kamukha ng jeepney, di ba? This is where yung honesty, yung discipline natin should come in. Siyempre, if you think that you have symptoms that might be COVID, hindi ka naman talaga dapat lalabas ng bahay, di ba? So, we should not go out kapag meron tayong symptoms or we think we have been significantly exposed to a COVID positive patient. Sa mga ibang regions, they have modified their buses. No, nakita ko yung pinost dati ni Dr. Brian Lim sa Cebu, na modify na yung itsura ng mga buses, no, naging malalaki na yung windows, tapos pati yung mga seat arrangement ng seats na iba na rin. I wish this could be done in other regions as well, pero medyo baka mahirap for Metro Manila. Na hindi naman natin basta mababago, no, yung mga itsura, pero because COVID might linger a little longer or longer, kailangan pa rin nating i-improve yung transportation system natin. So I don't know if others can add to this.
I think the bottom line here is we need to really protect ourselves. Be mindful, no, kung we are in the public place, public transportation. Be mindful dun sa ating ginagawa, sa ating mga sinusuot na mga PPE. Any other thoughts, Dr. Rojas? What are your thoughts when we're riding public transportation? For example, MRT, LRT. Kapag puno, wag na lang tayong sumakay. Ganun ba? Baba na lang tayo ng station.
I agree with all the comments of Ma'am Chi. Yung ano ko lang is yun nga, iba tulad ng Swiss cheese model. So meron tayong personal or self-responsibilities and meron ding shared responsibilities. And I think yung I think the Department of Transportation in charge dyan, meron silang responsibility na ginagawa to ensure that the public will be protected. Pero tayo, on our part, dapat we should do our own responsibilities. Then we should perform that. So, yun nga. So, basta magtutulungan, pwede namang ma-prevent pa rin. So, kahit nasa public na. So, lalo na ngayon na slowly opening up na tayo with situation.
Thank you, Dr. Eva. Dr. Pam, I have a question for you. Safe na ba tayo pumunta sa mga clinic ng mga doktor and hospital nowadays? There's a question sa ating Facebook page, no? Is it safe to have surgery in the hospital at this time? Will I be at risk of getting COVID if I go to the hospital? So mayroon pa rin mga agam-agam ang mga tao kung pupunta sila sa hospital or sa clinic ng mga doktor o hindi. Anong mapapayo mo, Dr. Pam?
Okay. Unang-una, pupunta tayo sa hospital for a lot of reasons at karamihan doon ay upang magpa-check up sa ating mga doktor. So pupunta tayo dapat sa hospital kung kailangan nating magpa-check up. So if you really need to go to the doctor, kung hindi pwede ang telemedicine, you go to the hospital. Now, there are several strategies ang ginagawa ang mga different hospitals to check kung kailangan ba ikaw ay pwede sa normal na entrance or kailangan doon ka sa area na para sa taong may respiratory infection. So, talagang parang tinatriage, no? Hindi lahat ng pwede pupunta sa ganitong entrance, pwede. So, kung may sakit ka, iba yung entrance mo. So, ganun yon. Maraming ginagawang strategies yung hospital to prevent spread of infection. About naman sa surgery, depende yan sa hospital policies nyo. Sa ngayon, maraming hospitals ang pumapayag na magsisurgery kung ito ay emergency or semi-emergency na kaso. No? May mga policies din na kailangan sundin ng isang pasyente, katulad for example, kung emergency, syempre talagang gagawin yan kasi stat yan. Yung emergency surgery, it could save your life, no? Ngayon, may ibang surgery na hindi kailangan gawin kaagad. So, ang ina-advise sa mga pasyente ay mag-quarantine ng ilang araw prior to surgery, no? Dapat wala silang respiratory infection. Ang ibang hospitals, meron silang policy na before magsi-surgery, 2 to 3 days prior to surgery, kailangan magpa-swab ka, titingnan kung ikaw ba ay may SARS-CoV-2 virus. So, meron ding mga hospital hinihingi ang clearance from the infectious disease service kung pwede kang mag-surgery. So, may mga polisiya tayo in place para kung kailangan ng surgery, magagawa yon.
Correct. So may mga protocols naman na ginagawa to make sure that everyone from doctors to patients ay safe sa hospital. And if I may quote Dr. Marion Aureliado Quek, mas safe na daw sa hospital kasi may engineering and administrative controls that are in place. Mas safe sa hospital kaysa sa mall. Thank you, Dr. Quek, for that. One of the reasons kung bakit pupunta ang isang pasyente sa hospital is vaccination. Kailangan magpabakuna. Ano ba yung ating recommendations for vaccinations? And can we get an update on the COVID-19 vaccine? Dr. Jem, who is part of the trial.
Okay, so for vaccination, siguro mas mas importante for pedia patients, no? Kasi may schedule yung vaccines nila and we don't want them to miss their vaccination kasi it will put them naman at risk of getting other infections. So for that, pwede kayong mag-schedule ng appointment sa inyong doctor or sa inyong pediatrician. Usually po kasi yung mga pediatrician, meron silang well baby or well child clinic. So dyan nila pinapapunta yung mga walang sakit but just coming in for check-up or vaccination. So isang strategy po yan para at least maiwasan po ang exposure sa mga taong may sakit. So hindi isasabay yung mga well children sa mga may sakit. So that's one, you can still visit your doctor and set an appointment for vaccination as long as you still maintain the minimum public health standards and the proper precautions. As to vaccines, probably this is referring to flu and pneumonia vaccine, ano?
Yes.
So it's still recommended to get the flu and pneumonia vaccine. Actually, kahit naman po walang COVID, part naman po ng recommendation natin na dapat magkakaroon tayo ng annual influenza vaccine and also the pneumonia vaccine. Recommended rin po yan sa immunocompetent adults and most especially sa elderly in order to prevent getting pneumonia. Because yung flu, yung influenza at saka yung streptococcal pneumonia na pinaprevent ng pneumococcal vaccine, they can present in the same way as COVID. Pareho ho yung simptomas. So ayaw na natin na magkaroon pa kayo ng risk of getting the other diseases that can present as COVID-19. As for the COVID-19 vaccine, as of now, as we speak, wala pa po tayong evidence or data sa efficacy or bisa ng vaccine and sa safety. Because, like dito po sa Pilipinas, mag-uumpisa pa lang yung clinical trial ng World Health Organization. So, it's just about to start yung clinical trial about the vaccine. So, as of the moment, we don't have any recommendation yet for COVID-19 vaccine.
Okay. Thank you for that. So something that we should look forward to, no? The COVID-19 vaccine. I'm going back to Dr. Chi Abu. Ma'am, may mga tayo ngayon malapit na ang Christmas. Malapit tayong Christmas party, family gatherings. Si Dr. Roman may binabalak na summer outing and swimming. Is it safe to be in such gatherings, and what should people observe when they are in such social gatherings?
Dahil to sa Christmas, no, syempre mga Filipinos talaga, we celebrate Christmas, no, for personal, for social, for religious reasons. September 1 pa lang, umpisa na ng Pasko. Kaya parang madaming ngayon, no, anxieties. Paano ba tayo magki-Christmas? So, ganun. Tapos marami pang mga ibang, syempre, concerns dahil we have the pandemic. So, siguro, sa akin, as families, so, let's continue the celebration, no? Tuloy na tuloy pa rin ang Pasko, no? Let's continue with our cherished traditions. Lalo na kung yung mga ka-celebrate naman natin, kasama natin talaga sa bahay, no? So, we continue to put up the Christmas tree, yung countdown ng mga bata, yung mga 20 days na lang, 10 days na lang, gano'n, Noche Buena, devotion, yung gift giving, tuloy-tuloy yon for the family. Kasi nakikita naman natin sila, no? We're able to monitor each other's symptoms. Ang question kasi dito, magki-Christmas party ba tayo? Kunyari, sa hospital, o kaya ako, I teach in the College of Medicine. Nakita ko na yung announcement, it's going to be a virtual Christmas party for the College of Medicine sa Lasal. So sabi ko, masaya ba yun? Sabi ko nga gano'n. Pero I think it can be done. Virtual, may mga contest pa din na parang caroling, no, na siguro yung mga nakikita natin, yung kumakanta ng hiwa-hiwalay, tapos meron pang gawaan ng Christmas card. So, I think they can still be done virtually, no, kung yun yung iniisip natin safest for us. If we're going to plan for a family reunion, kunyari, malaking Christmas party. Kami kasi taon-taon nagki-Christmas reunion kami, pero I'm still thinking about it now, considering the following, no? Yung mga guidelines na binibigay sa atin. Number 1, kung saan man kayo magtitipo ng malakihan, number 1, you consider the community level of COVID-19. Baka sobrang dami pa doon sa area na yon. And you know that the attendees, dahil reunion siya, iba-iba sila ng panggagalingan. So, tingnan din natin yung level din ng COVID sa pinanggalingan nila. Yung location of the gathering, saan natin siya gagawin? Sabi nga natin, outdoor is always better than indoor for better ventilation. Diba? Gusto nyo ba ng garden party? Baka better yon, ganon. How long, gaano katagal, ilang oras magsistay doon? And what will be the activities? Kasi syempre yung mga activities, yun yung mag-i-increase or maglo-lower ng transmission ng COVID, no? Syempre, yung mga behavior ang attendance we have to consider. Ito naman, understood na yung fact that if you are sick or if you have been exposed, hindi ka naman talaga dapat pumunta doon. So you're not supposed to attend. Number 1, if you have been diagnosed with COVID-19, tas hindi ka ba nakiklear, no, ng physician. If you have symptoms that might be COVID, if you're waiting for a COVID test, di ba? Yung iba na-expose, tapos hinihintay pa nila yung result, dapat hindi ka lalabas until you get it. Kahit na yun na yung day ng ating reunion. So, exposure in the last 14 days. And of course, consider yung may mga increased risk of severe illness, di ba? Nabanggit kanina yung elderly, yung pregnant, at saka yung mga immunocompromised host. So, in the end, ano bang ibibigay nating gift sa mga mahal natin sa buhay, no? Sa ating family, friends. The last thing we want to give them is COVID-19 virus or infection. So let's plan our celebration. I know it's going to be different than the previous year, pero it can still be meaningful, no? This is the kind of Christmas that we will forever remember kasi COVID Christmas to eh. So, let's just plan considering all the factors, no, that might increase or decrease the transmission. So, I think yun yung aking sagot doon.
I think that answered the question. One of the questions I posted a while ago. What's the best gift we can give our loved ones this COVID Christmas? I guess safety and good health. May pahabol na question sa PPE, if I may ask this kasi baka malimutan natin. Dr. Eva Rojas, how about yung KN95, KF94, and nano mask? Are they even recommended? Can the healthcare workers use these masks?
Sige, so siguro ang meron na ako talaga na nasama namin dun sa guideline is about KN95. So ito meron kami nakitang mga articles about KN95. So ano bang difference ni KN95 with N95? So actually, they are both filtering. So for filtering, more than 95% of the particles. Kaya lang, ang difference ni N95, yung tinatawag nilang TIL or yung total inward leakage is 0%. While si KN95, meron pa siyang 8% na total inward leakage. So kung saan pwede pang pumasok yung mga respiratory particles. So kung tatanungin, pwede bang gamitin? Kung aerosol generating procedures, ang recommendation talaga is N95. That's the ideal. However, kanina hindi ko nasama sa lecture ko, pero in some other more extensive lectures, nasama ko na during this time na meron ng issue ng shortage of these PPEs, particularly your N95, they recommend extended use of N95 or even the use of other masks aside from N95. So, kung wala talagang N95, as long as yung KN95, di ba sa N95 natin dapat naka-fit test? So, as long as your KN95 is also fit tested to you, tapos approved naman, you can use that as an alternative. So, we have this, all of this, ano ba to, tawag nito, contingency plans. Kasi nga, we're faced with a pandemic. So, hindi natin alam kung hanggang kailan. So, hindi na yung ideal setup. So, KN95, pwede. I'm not so sure. Ano yung isa, Mark?
KN94 at saka nano mask.
Nano mask. So, hindi pa ako nakakakita talaga ng nanomask. I'm not so sure with the other mask. Maybe yung other panelists natin. Pero si KN95 kasi yung more as nagagamit, di ba?
Yeah, it's more commonly used. Pero personally, I don't like it kasi hindi siya well-fitted sa face ko. So as long as, I guess, it's well-fitted, it's fit tested, then it's fit checked, and then it may be used. I think that's about the bottom line sa N95 or KN95. Dr. Jem, I'd like to ask you your opinion on the use of those necklace na may personal air purifier. Is it even effective? I know just recently DOH released its memo on that.
Yung mechanism kasi ng mga necklace na air purifiers, they emit yung mga negative ions. So parang ginagawa ng mga ions na yan, nag-a-attach sila sa mga particles like allergens, pollutants, and even viral particles to make them heavy. Bibigat sila pag nag-attach, babagsak sa floor or sa surface. But as of this time, wala naman tayong evidence that wearing those will actually prevent COVID-19. So pwedeng theoretically, kung isipin mo, baka may benefit, pero sa atin kasi mas importante yung clinically relevant outcome. Talaga bang mape-prevent niya na magka-COVID ang isang tao pag sinuot niya yung necklace air purifiers na yan? At sa ngayon, wala tayong ebidensya na talagang magpe-prevent siya. And another thing to consider, pag bibili kayo ng mga air purifiers or those necklace na personal purifiers, titignan nyo yung some of them kasi nag-i-emit ng ozone. So may some level of ozone na ini-emit. Dapat mamimit niya yung safety criteria that it's not harmful to the environment and to the one wearing it. And also, important pa din, since nga ang mechanism noon ay babagsak niya sa surfaces yung mga particles or the viral particles or even the pollutants, then it should follow na maglilinis tayo ng mga surfaces frequently. So, katulad ng sinabi kanina, hindi lang talaga isang strategy yung gagawin natin. It's really a combination of different strategies para ma-prevent ang transmission ng COVID.
Okay, thank you, Dr. Garcia. Ito kay Dr. Chi. Dr. Abu, kanina sinabi ni Dr. Rojas, high-intensity physical activity. How about sex? What are the necessary precautions that you need to observe while having sex? Whether it's lights on or lights off.
May ganyan talaga, Mark. Ako talaga yan.
The most capable to
talaga
answer.
yan.
Di ba?
Uy, naka-live tayo, ha? Okay. Ano bang sasabihin ko dyan? Gabi talaga to si Mark. No? Sige, balik tayo dun sa primary mode of transmission ng COVID, ha? Which is droplet. Diba? Coughing, sneezing, singing. Ito na. Heavy breathing. Shouting. Diba? Okay. Sige. Meron ding role yung saliva or mucus, diba? Although it has been found, no, sabi nila sa mga studies, yung virus has been found in semen and some fecal material. It has not been found to effectively transmit through sexual transmission. So it's not considered an STI or sexually transmissible infection. Pero makaka-transmit siya talaga during sexual activity because this activity involves other things like kissing, di ba? Siyempre, may droplet na yun, di ba? At saka touching, like the eyes, the nose, the mouth, the lips, di ba? So, ang hirap mag-elaborate, no? Pero, you can imagine how it's transmitted. So, ano bang precaution? So, hindi talaga siya STI, but it can be transmitted kasi wala ka na talagang distance doon. Very, very close contact na talaga yon. That's the reason why, siguro in the last 3 months, may mga admissions talaga tayong mga ID na husband and wife, no? Because they share the same room, they share the same bed, they share the same bathroom. So, napakataas ng possibility ng transmission. So, paano ba yung precautions doon? Even without thought of sexual activity, ganon din naman, di ba? I think you're not supposed to do it with your spouse or with your partner if you have symptoms because you're supposed to isolate or get tested. Madali lang yon if you live together. Also, if you have been exposed, kailangan sabihin mo yon. You have to be honest about it dun sa partner mo, di ba? Kasi para hindi ka makahawa. Siguro, parang yung sorry nating parating, love can be expressed in so many ways, different ways. So,
and like what Dr. Bergetin said, love protects.
Love protects, no? So, ayaw mo naman siyang mahawa talaga. So, I think, yun na yung sagot doon, Mark. No, unless meron kayo dadagdag, no? Or the others.
The other panelists are welcome to.
Wag gagawin yun with those who are outside of your household. Or, syempre, Sige, ayoko na nga mag-elaborate pa. Sige.
Okay. Now, going back to Dr. Rojas, bago saan pa tayo mapunta, nakalimutan yata natin na live tayo ngayon. Dr. Rojas, may question tayo regarding the omnibus interim guideline of the DOH. Well, the DOH memo 2020-0439 was just released. First question, when is it safe to discharge a patient from isolation? I think merong mga inconsistencies dun sa document na yon. Do we still need to quarantine the patient after that specific number of days of isolation? And if I may ask also this question from Ms. Garcia, Camille Garcia, the quarantine for the symptomatic confirmed cases was reduced from 14 days to just 10 days, with at least 3 days of being asymptomatic. Can we clarify daw kung the current terms, if applicable na ito sa setting natin? I think marami talagang problema kasi iba yung sa WHO and CDC, iba yung previously released ng DOH, and now DOH came out with another omnibus interim guidelines. What are your thoughts, Dr. Eva?
Oo. So medyo nga nakakalito yan. So ang advice ko lang dun sa public, no. So wag niyo nang problemahin yan. Si doctor or si practitioners ng bayaan mo. So you just follow kasi somehow minsan kung marami kang naririnig, maguguluhan ka talaga. So ang recommendation na ngayon is medyo labo-labo nga from before na we rely on the test-based approach, dapat negative, but now we shifted to time-based and then symptom-based approach, diba? So, ang requirement talaga is yung 14 days. So, we count 14 days, particularly if you're mild, okay, or moderate, so 14 days. And ensure that you're 3 days na asymptomatic, diba? Ngayon, kung medyo severe or critical, sometimes they prolong it to 21 days na isolation yung count. And yun nga, andun parati yung dapat ma-ensure yan na 3 days na asymptomatic ka na. So it's both the time and then you consider na dapat 3 araw na sunod na wala ka na talagang symptoms before you can be, yung sabi nila yung mga pasyente, ma-release sa Bartolina. Or kalaya ba? Oo.
Okay, thank you for that, Dr. Eva. There's this one question regarding the vaccine. Going back to Dr. Jem, the vaccine is not a sure savior at this time. Limited pa yung evidences of its efficacy and even its safety. When do you think can we go back to a more relaxed community where there's no fear of COVID? Naka-mute ka, Dr.
Sorry. Sorry. Yeah, so difficult question, no? When? I don't have a specific time or date kung kailan. But ang sure dyan, kung tuloy-tuloy natin i-maintain yung ating infection control measures, ang ating mga safety protocols, then tuloy-tuloy bababa yung mga cases and unti-unti marirelax ng government yung mga quarantine levels. Diba pinakita ni Doc Eva kanina na iba-iba yung levels of quarantine depende doon sa number of cases or sa doubling time. So kung mas mabilis, bababa ang mga kaso dahil tuloy-tuloy tayo nag-iingat at tuloy-tuloy tayong sumusunod sa mga infection control measures, then mas mabilis na marirelax yung ating community and mas maaga tayo makakabalik sa normal. Yon, I think that will be my answer to that because we really can't say. So the better we perform, the sooner we will be back to a more relaxed community.
Okay, thank you, Dr. Jem. I have some inputs from our president, Dr. Isa. Shout out to our president, Dr. Isa Alendria. Our current guidelines, let us clarify that. Our current guidelines is that for asymptomatic patients, isolation should be 10 days from the initial positive test. These are for COVID positive asymptomatics. For COVID positive with mild to moderate symptoms, it would be 10 days of isolation plus at least 3 consecutive days of being asymptomatic. But for severe and critical, it will be 21 days. Okay? Again, that's
So
from
correction lang yun, Sir
PSMID.
Dr. Mark, no? So correction.
Yes.
So sabi ko kasi
Yes.
kanina 14 days, but for mild to moderate, PISMID guidelines pala 10 days. So,
10 days. Okay. Thank
so
you.
correction po.
That's the latest recommendation. But again, I think we need to really wait for the final recommendations from DOH and the PSMID. Okay, we have a few minutes to cap off this webinar. Thank you to our panelists and our speaker. But I'd like to give the floor to the four of you again, and I'd like to ask this one question. Give me 2 to 3 lines to answer this question. How do you see 2021? Dr. Pam Ferrer, let's start
Okay.
from Davao.
Okay, pag Miss Universe talaga yung question mo. Okay, for
You have 30
2021, sa aking mahiwagang okay, I see the economy will open for 2021. Hopefully, by the end of 2021, meron na sanang effective vaccine for SARS-CoV-2, no? And hopefully, by that time, makakapag-travel na tayo somewhere out there, makapag-beach na tayo, no? And still, we maintain the minimum health standards, no? Para hindi tayo bumalik sa dati, nung early days of the pandemic. At sa lahat-lahat, isang message ko rin is hindi tayo dapat mawalan ng pag-asa kasi matatapos din ang lahat ng ito. Thank you at maraming salamat.
Now let's go to Cavite. Dr. Chiabu.
O dahil Deliverance, no, yung guidelines ng Department of Health, yung definition niya ng new normal are your behaviors and the minimum public health standards that will be made routine even after the pandemic is over kasi wala pa nga tayong widespread vaccination. So the reason we did this webinar is for us to have a better normal. So for 2021, hopefully every Filipino has embraced the better normal, the better way of doing things. Kasi hindi na masakit sa dibdib natin o sa loob natin na mag-abide by the minimum public health standards and nakatanim na rin sa puso natin yung we heal as one. And let us not forget the lessons learned from this pandemic. Books will be written, journals will be written about COVID-19, and this is something that we will never forget. Thank you sa lahat ng mga nakikinig from webinar G to O to L to D. I'm very, very proud to be a part of PISMID as we are celebrating the 50th anniversary. So celebrate with us as we celebrate also Christmas and welcome 2021 with hope and joy. Yun lang. Thank you.
Thank you, Dr. Chi. Now let's go to Las Piñas. Dr. Gemini Garcia. Oh no, sorry. Alabang Muntinlupa pala siya ngayon.
South Luzon.
Dr. Gem?
Okay. Sige. So, thank you very much, Dr. Pasayan, for that wonderful question. So, for me, for 2021, I see an enlightened, an empowered, and a caring society, not only in the Philippines, but I guess all over the world. No, enlightened because mas marami na tayong alam tungkol sa COVID-19. Alam na natin kung paano siya nahahawa. Empowered because alam na natin kung paano iiwasan yung sakit, kung paano poproteksyonan yung sarili natin. And caring because I think after all of this, we learn to care not only for ourselves but also for our neighbor. So, di ba, love yourself as you love your neighbor. So, iniiwasan mong magkasakit because ayaw mo rin na maipasa yan sa mga loved ones mo, sa family, sa friends. So, yon, we will have an enlightened, empowered, and caring society in 2021.
Thank you, Dr. Jen.
And
And
I
of
thank
course,
you.
our speaker, Dr. Evelyn Rojas.
From Manila.
I'm from San Andres Bukid, Manila. What
Thank
a
you, Dr. Pasayan, for that wonderful question, sabi ng Doc Jen. So, I agree with all our panelists. So, 2021, so malapit na, 2 months na lang, we're entering a new year. So, I see, so hindi lang Philippines, so the whole world as having more knowledge about this initially novel, yun nga, new, na wala tayong kaalam-alam, but now, as we enter 2021, we have more knowledge about it in terms of transmission, prevention, and even treatment and prevention with vaccination. Pero I just want to remind everyone, so ikaw to si Doc Sonia. Hi Doc Sonia, salamat. Sabi niya, ang COVID-19 daw parang nagbibisikleta. So kung kailan ka marunong na, okay, pag marunong ka na, minsan hindi ka na ganun ka-careful, baka yung pa yung time na sumemplang ka. So we don't want to happen that in 2021. So with all of this knowledge, basic knowledge about COVID-19 and continuously increasing knowledge about the disease. So we continue to fight against COVID-19. So hindi pa tapos ang laban, pero sabi nga ni na Doc Pam, ang lahat ay may katapusan. So together we can heal us on and we will be able to fight this COVID-19. I thank you.
Thank you. Thank you, Dr. Rojas. And thank you for the wonderful lecture. Thank you to our panelists for your reactions and thoughts. Again, this is Gold, the Peace Mid webinar series, wrapping up. And we would like to invite you to join us during our 42nd annual convention on December 1 to December 5. For details, please visit psmidvirtual2020.com. This is open for all health professionals. And we hope to see you there. And this is again Dr. Posayan signing off, and have a good evening and still stay safe.
Thank you.